Now let's begin the conversation. The welfare of healthcare workers remains critical to any functional health system. In Zamfara State, the government has taken deliberate steps in that direction. The state government has approved a salary increase for medical doctors above the federal salary structure. The state government also plans to recruit 631 health workers to strengthen service delivery across the state. Now, according to the State Commissioner for Health, Nafisa Maradun, the recruitment is part of a broader healthcare reform agenda under the administration of Governor Dauda Lawal. Congratulations to the doctors and also the health workers in Zamfara State. One might want to imagine what inspired the governor to go this route, increasing the salary of the doctors and also employing 631 health workers. Your thoughts, Educator?
Well, the Zamfara State is now the first state you think of if you're a brand new doctor to go and sit down. Basically, people look for Abuja, Lagos, all the urban areas. So what the governor is doing is basically to make it worthwhile for quality health professionals to come into Zanfara and work. And the only way you can do that is to pay them such an humongous amount of money that will attract them to come in and stay in the first place. Dr. Dauda Lawal has shown a very remarkable tendency when it comes to the welfare of his people. Despite the fact that Zanfara is about 34th in terms of healthcare delivery in Nigeria.
Oh, 34.
When you grade the states, he has not given up on his people and is willing to give them the best they can. So when the governor does this, move away from the usual palliatives, he tells a long-term story of what he wanted for his people going forward.
And it's not just about employing the 631 health workers. Are they going to be evenly spread, most especially to the rural areas, to the underserved, places, so that they get good quality service?
I'm sure they come to that number of 600 and something based on the needs they must have identified within the government circle. That, okay, going forward, how many doctors and nurses do we need right now in Zamfara State? How many can we afford? Can we pay their emoluments and all that? So as far as I'm concerned, the governor is doing the right thing. Because you and I know that health is wealth.
Sure.
If you do not have health, you can have all the money in the world. It's not going to change the fact that you are not well.
True. Absolutely. All right, just been told that BKO is right now joining us from our Abuja studio. BKO, it's so good to have you join us.
Yeah, good afternoon,
Yes. All right, so BKO, congratulations to the doctors and also health workers in Zamfara State. What inspired the governor to go this route? Increasing salaries and also employing, more health workers. Talk to me, BKO.
Yeah, this is a piece of good news. This is what we want governors to do. Do your best to take steps to ease the pains of our people. This is a big incentive to doctors serving in Zamfara State. I'm sure many of them who are not even from Zamfara State, or those of them who are even on youth service, national youth service, will be happy to remain there, because working in Zamfara as a medical doctor has now been incentivized. The new pay structure that we are talking about is higher than that of the federal government. So it's deliberately done this to make it attractive, to make Zamfara attractive to doctors in our country. And another thing that the governor has done that I'm really happy about is addressing acute manpower shortages in the health sector of the state. Nurses, midwives, and other categories of health workers are being hired now so that they can address that serious manpower shortage and in the health sector of the state. And he is also doing his best to improve maternal and child health outcomes in the state by providing the equipment that these hospitals need. Now we are seeing MRI and endoscopy machines being brought in to improve diagnosis and treatment in the state-owned hospitals. One other thing that the governor has done that has really made me happy is the approval of 50% hospital discount to persons living with disabilities across all government-owned hospitals in Zamfara State. So this will help our people in Zamfara State to achieve access to health care, as well as achieve the dignity for people living with disabilities. So this higher pay for doctors is what we've always asked for. If doctors don't want to serve in rural areas, for example, many of them like to work in the tertiary health institutions. You've got to incentivize working in the rural areas. Provide them with security, because bandits target doctors a lot. Provide them with security, give them housing, give them those things that will make practicing in the rural areas a lot more joyful for these people. By the time you do this, a lot of them, naturally, they are happy to be doctors, they are happy to be caregivers. So by the time you provide those things that are big-time incentives for them to work in the rural areas, because a lot of our rural areas are underserved.
Yes.
The primary health centers, in most cases, don't even have doctors. They have midwives, they have nurses. But we need doctors to be on ground in the primary health centers across the political wards in the states, so that they can deal with emergencies. There are emergencies that nurses, midwives, ancillary nurses cannot deal with, that trained doctors will easily address. So if we have this situation, then people don't need to go all the way to the tertiary health institutions, the secondary health institutions, just because they want to be treated for all kinds of ailments. The tertiary health institutions should be the last port of call and should be centers of research and qualitative training for doctors in training. So it shouldn't be where everybody goes to.
All right, then.
So we need to equip the primary health centers. We need to give them their rights. We need to give them medical personnel that will be able to address the concerns that take people to those primary health centers.
Absolutely. I mean, now with all of this, residents of Zamfara should expect improvement in healthcare going forward. All right, let's move straight to